This is a conference for you, for us, and let me tell you this now. This conference is going to change you.
So we work to support healthcare professionals, social care professionals, policymakers, people living with diabetes, and community leaders. And we really want to support, connect, and ultimately improve outcomes in diabetes and related diseases.
We have people from all over the world today. That is truly amazing.
For those of you who were here last year, I cannot believe we're here again. A year has passed already. This is fantastic and scary. Can you hear me okay? Can everyone hear me okay? Okay, so welcome, welcome, welcome. I'm so pleased to see so many familiar faces and some new faces here this morning. I'm told, you always just go straight to the point. You never say anything about Diabetes Africa and who we are. So I thought I'd change that today. So who we are. It's not working? Oh.
Make sure you press the button. There you go. That's great.
Hello.
There you go.
Okay. So we're a non-profit organization. We were registered in 2019. And the reason we started this organization is so many of my friends, families, and loved ones live with diabetes, many of the different subtypes. And we realized that there wasn't enough resource, really time, or specifically tailored efforts to help them with their diabetes. So my grandma, she was a mental health matron in the NHS. In the 1960s, 70s, she said, stop complaining and do something about it. So that's why I'm here today with you all, and I'm really excited for today. So we work to support healthcare professionals, social care professionals, policymakers, people living with diabetes, and community leaders along this same mission. And we really want to support, connect, and ultimately improve outcomes in diabetes and related diseases. So our mission is eventually to eradicate diabetes and related diseases in people of Black heritage globally. As you can tell, I'm British, but as you can also tell, I've lived a lot of different places as well. So it's for people of Black heritage globally. Our name, yes, is Diabetes Africa, and people often assume initially that we only cater for people based in Africa. We do more than that, but of course we do support people based in Africa. So one of the projects that we're very proud to talk about is we're in the process of creating the specialty of diabetes specialist nurse in Ethiopia alongside our partners, St. Paul's Hospital and the Ministry of Health and other partners there. So that is really on our capacity building, our long-term vision for our work. We also launched a master's degree in diabetes education in the University of Abuja in Nigeria. Once again, our ethos is about sustainable change. We don't want to come and do a training for a few weeks and then go away and everything goes back to what it was. So we're really proud of that project. But more close to home, and I'm delighted because we have some of the partner organizations in the room this morning. We've worked on culturally tailored programs in diabetes and weight management, to name a few. So we did some support for the trainers training for Heal D, which is the culturally tailored program led by Prof. Louise Goff. We've also worked on Up, which is a Lewisham culturally tailored program for weight management. Fits Me Well, which is a similar program in Lambeth. And also we were part of other projects such as task and finish groups to improve outcomes for communities that are struggling with diabetes and weight management. So we did that in partnership with 360 Lifestyle Support, Adeyileka-Tracz, and also the Lewisham Care Partnership. We also have, you might recognize some of the faces on the screen because they're in the room here today, but we also co-creating diabetes support groups for younger people of Black heritage, and we're really thankful to Novo Nordisk, who provided us the support to be able to do that. So we're hoping to expand that project moving forward this year, next year, hopefully. We also run a series of virtual events with another familiar face you might see there on the screen, who's going to be speaking after me. That's really to support people living with diabetes and healthcare professionals of Black heritage with a number of topics, and many of the speakers are going to be joining us here today for this event. We're also I have to say a big thank you to Eli Lilly for their support and enabling us to do that, so thank you very much. We're also hugely proud of our Diabetes, Foot Care and Dark Skin Tones Handbook. We have a select number of printed copies for people who would like a printed copy. There's not one for everyone. I know we have a competitive group in the audience, so we don't want any fighting, but there will be enough for a good few of you. We'll release those later. And you can also download the digital copy using the QR code there. But that was supported by Monica, who are here, but they don't have a stand here today, but we're really thankful for their support. Also, hugely proud of our toolkit on improving equity and access to diabetes technology. You should all have a copy of that to flick through and have a look, but you can download a digital copy of that handbook. And I don't want to say lastminute.com, but we have also a toolkit for advancing equity in pregnancy outcomes. It's out this morning for consultation, so if you can scan the QR code, in the pregnancy session we'll make the QR code available again, but we're looking for comments and your thoughts on what we've put together so far. Us being overly ambitious, we would like to do 5. We've done 2 so far. If there's anyone in the audience who would like to get involved with the other toolkits, or any organizations who would like to support us to develop the toolkits, please get in contact. And just to say, we are so honored that people actually engage with us. It can be quite tricky sometimes when you're working on a topic for underserved communities, but I think sometimes we look back at the numbers and say, people are interested in what we do, so we're really thankful. We've had over 117,000 YouTube views, 20,000 plus downloads of our various toolkits and handbooks, and people have accessed our work quite a few times, so we're really proud and thankful. On to today. Huge thank you to our partners, CAN, Diabetes UK, King's Health Partners, Percy, Natasha, and Samuel. I don't think they're here yet. If you are, put your hand up. No. Stephen, definitely here. Thank you so much, alongside other Diabetes UK colleagues, Becky, Rosie, and Joe Sparks. But we have some additional King's Health Partners support. Also to our sponsors, we would not be able to do this without their support. So I feel really blessed and humbled that they believed in us, believed that we could pull it together. Please go visit the stands in the neighborhood room where the tea, coffee, and food is, have some conversations, but we're really thankful to our sponsors for their support. And finally, the committee. We have had, I don't know how many emails. It's been a lot of emails, it's been a lot of discussion, a lot of planning, but thank you to Barbara, Ray, Mira, Evie, Tolu, and Joan for all the work that we put in for today. I hope you'll have a fun day. Range of topics. We're going to have Luxme doing skin tone tools, so we're actually going to find out what skin tone we have if you don't already know. I think most people probably don't know what skin tone we have specifically. We're going to have Dr. Claire Hamlin going to do an overview of the whole horizon of the NHS, which we're very excited because I know there's a lot going on. We're going to have a foot care session, pregnancy, stigma, we're going to be tasting real African Caribbean food. We're going to have chin-chin, snacks, food for everything. Jasmine, where's Jasmine's going to be speaking? And is Shola here yet? Shola, shout if you're here. Shola! Hey! So Shola from Food for Purpose, Jasmine from Carbon Nutrition is going to be leading that session. Did you get Niger Fanta? Oh. Okay, so we're going to have some drinks for you to try. And I've mentioned this already. I'm going to briefly pass on to my fantastic colleague, my mentor, just one of the most fantastic human beings I've ever met, who's incredibly supportive of everything we do, and has been doing this a long time as well. So I'm going to hand over to Dr. Joan St. John.
Thank you, Bernadette. I hope you can hear me. My name is Joan St. John. I was the nominal chairperson of the organising committee, and I'd like the organising committee to stand up, please. Yeah, you're going to be doing a lot of this today, so stand up, please. These are... We don't have all the individuals, but these are the fantastic individuals who have put together this wonderful programme. So I was asked to say a few words about what this conference means to me. And before I do that...
Do you want your slides?
Yeah, I think so. I'm going to extricate this from here. Yeah, before I do that, one of the wonderful things that I've experienced when I've been to West Africa, but I'm sure it happens all over the world, is when you go to a place, people don't say, you know, you're introduced to people, they don't say hi, they say you are welcome. Do you recognise that? Yeah? And to me, that's such a warm greeting. It's such a sort of inclusive greeting. It's you're going to share in what I have, whether it's the food, whether it's the space, whatever I have, it's partly yours. So what I want to say to you, first of all, today is you are welcome. This is a conference for you, for us, and let me tell you this now. This conference is going to change you. After today, you will be a different person. Whether it's because you've whether it's because you've tasted the food. You may not have tasted it before. Whether it's because you've spoken to people you haven't spoken to before. Whether it's because you've made connections that you haven't made before. Whether it's because you've got on social media and you haven't done that before. My mum calls it WhatsApp. She doesn't know about WhatsApp, that was before her time, so it's WhatsApp. Get on your socials and spread the word. We have people from all over the world today. That is truly amazing. I have to give a big shout out. I think, Annabelle, you're the furthest one from Bermuda, but maybe there's somebody who's come further. South Africa, there you go. And I think last year we had somebody from Kenya, okay? So one of the things I also want to do, yes, I've got slides, yes, I will talk very, very briefly through them, but what I want to say is it is absolutely fantastic because when I was a younger doctor, I'm of a certain vintage now, growing up in the field of diabetes, and I looked around, there weren't many people who looked like me. When I went to conferences, there weren't many topics that dealt with people who looked like me. So to be in a room this morning with people who are concentrated, focused on people who look like me living with diabetes, it's just truly amazing and quite emotional. But I'm not going to get emotional. So I want to start with where we started. The first documentation of diabetes, continent of... Come on, guys. Say it loud, okay? Africa, yes? And here we are doing a forum entirely on people of African Caribbean heritage. It's truly marvellous. So let's work together to do what we can to improve the outcomes. Because last year we had our inaugural event. But, you know, there have been lots of great ideas in the past, lots of great people who've worked on great things and not been able to sustain it. And here we are doing our second. And next year, we will be doing our third. Yeah? Okay. Let me also tell you, I told you you're going to change after today. Also, there'll be a lot of hard work. So get used to that, okay? Because what will happen is there'll be lots of questions. I used to go to conferences, had lots of questions, but didn't get the answers. I'm not saying you're going to get the answers today, but what you will do is start to think about those questions. Start to think about who you can collaborate with, who you can network with to find those answers. We need to be doing something about technology. We need to be doing something about stigma. We need to be doing something about pregnancy. Foot, feet, eyes, kidneys, weight, the lot. Supporting ourselves. We need to be doing all of those things. So I want to say two things about change. Do you know Angela Davis? Civil rights activist, yes? I am no longer accepting the things I cannot change, and I am changing the things I cannot accept. Okay? So that's what we'll be doing today. And then, yeah, we've done some of that. Okay, when you look at where we were last year, the foot care handbook, we didn't have that. The technology toolkit, we didn't have that. The support groups, we didn't have that. So we're changing things. And Barack Obama says, change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. So, be active on that WhatsApp. And please, 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 we've got lots of networking opportunities. Make good use of them. There are some fantastic experts in this room. There are fantastic knowledge in this room. Let's collaborate. Let's find some of the answers to the questions. So thanks, and you are all welcome. This is your conference. Thank you.